How much are you paying for health care? A few $100s, maybe even a few thousand for some of us. And those health care costs, as you well know, can add up. But did you know that you're also paying for the health care costs of criminals who are currently sitting behind bars? In tonight's special report, News Channel 20's Alicia Lewis takes a closer look at what exactly you're paying for.
Make control, can you override the outside door?
I've been to prison 3 times, so been to jail here. I was at the old county too, so I'm going to say probably maybe 20 years, probably 20 years.
Sangamon County Jail inmate Lynn Gilbert has spent nearly half of his life behind bars.
I was doing crack, cocaine, little meth, bunch of weed, smoked a lot of weed, drinking.
Drugs, theft, and burglary. Gilbert is what deputies call a frequent flyer, going in and out of jail for various crimes. And once behind bars, these inmates are well taken care of.
They receive the full range as if any citizen would get. They get medical care, which includes eye care, dental benefits, and also mental health care.
Right now, Sangamon County has a contract with Advanced Correctional Health Care, an on-site medical team comprised of doctors, nurses, and psychologists, some of which are on call 24/7.
Several years ago, we decided that we need to get out of the medical care business. We employed our own nurses, and it was very frustrating to us because we didn't really, we understand the law, we don't understand health care. So we decided that we would contract with another company, that would be their sole purpose, is to provide whatever medical care is needed in our jail.
In 2013, Sangamon County spent more than $783,000 on medical benefits inmates receive behind bars, and Sangamon County residents are footing the bill.
It's all taxpayers' dollars, and it comes out of our general fund, with the exception of a portion that comes out of the inmate welfare fund.
According to Sangamon County Undersheriff Jack Campbell, the inmate welfare fund covers only $50,000 of the $783,000 total. Money which accumulates over time from inmates purchasing commissary items such as snacks and phone services. But for some inmates, those who have money available, they have to pay a minimal medical fee.
If inmates have an insurance policy, we are able to charge that insurance policy and avoid using tax dollars to pay for their medical care, but very few inmates have that type of insurance.
This is the Sangamon County Sheriff's Office inmate charge sheet. This is what inmates are asked to pay if they have no money available, either from their bank accounts or through their insurance. As for the inmates who spend most of their days behind bars, Undersheriff Campbell says those are typically the ones who need round-the-clock medical care.
You'll have some inmates that have a medical condition, and they will constantly be in here and be treated for that one condition. But then you'll have other ones that will try to take advantage of a little bit of the entire system and all the benefits we offer.
For inmate Lynn Gilbert, he has been a diabetic for nearly 2 decades, receives 4 insulin shots a day, and says he's better taken care of and saves more money on health care behind bars than outside, a free man.
If I go to the hospital, the ER, they might cover most of it, but I still got to cover maybe $40 a month, $50 a month.
Okay. And here, how much would it be a month for you?
$15 a month. That's for my insulin, needles, and the prescriptions is $3 a script. So yeah, it's a lot cheaper.
Cheaper for the inmates who some deputies fear may be taking advantage of the system.
We're required to provide a certain amount of health care for them, and we know there are some that want to come in here to receive benefits, and we are told anecdotally that they will commit crimes just for the reason of getting in here. Now, why they're here, if you talk about them taking advantage of it, they have access to it. So I don't know that you could quantify it as taking advantage. It's simply something that they know they have access to, and they will go ahead and use that.
We looked into multiple county jails in central Illinois, all of which are dealing with various issues relating to inmates' health care costs. In part 2 of Benefits Behind Bars, we take a closer look into the major concerns these jails are facing when it comes to the mental health care of inmates, a growing concern not only here at home, but all across the state and country. You can watch part 2 of Benefits Behind Bars tomorrow night at 10.